Live from Studio 2A in PIX Plaza, this is the PIX 11 Morning News.
Listen, the temperatures, the wind chill, just brutal today. The frigid weather can be downright dangerous. And you know what I'm going to talk about? We're going to talk about frostbite. We're going to talk about hypothermia. Dr. Nancy Simpkins is a medical internist and consultant for the state of New Jersey. Thank you so much for being here. So when you see temperatures like this, and we're looking at, what, 9, wind chill, making it feel like -10 in some areas, -20. This is downright difficult
dangerous.
Weather and dangerous. What do you want to tell us? Top 5 problems that people will deal with.
Right. So the first one, of course, is hypothermia.
Right.
Then we worry about things like cold and flu, frostbite, depression, heart attacks, all of these things. So maybe we should run through them.
Yeah,
First
let's
one,
break it down. Hypothermia.
Hypothermia, a body temperature 95 degrees or below, medically dangerous. How does that happen? By being out in the prolonged time period of temperatures like these.
And not dressing properly.
Okay, so anything under 32 degrees,
okay,
which we are way below today, you may have no exposed skin. So that means all of those ski masks that people wear,
right,
ears must be covered, head must be covered, definitely fingers, warm socks, multiple layers. This is how we prevent. We have to keep the body heat in. If the body heat goes out through the skin or while we breathe out the warm air, we really can lower our body temperature to a dangerous level.
Yeah, we just saw those kids going to school, and, they weren't protected, but, moms and dads do the best that they can. So we'll talk about the cold and flu next. There was a new study from Yale School of Medicine that says that colds can actually lead to colds.
So maybe your mother was right?
Really?
Didn't your mother say put a jacket on, right?
Always.
Okay, so now we're learning that this new study from Yale, based on the rhinovirus multiplying, which is the #1 virus that causes colds. So the rhinovirus multiplies better in cold air. So yes, guess what? If you're outside breathing in that cold air where the rhinoviruses are multiplying,
wow,
guess what? Cover your face.
Now there's a study to prove it.
Exactly right. Mom was right all along.
Mom's always right. You know what? Never listen to the official. Mom's always right. Frostbite. This is very serious.
Frostbite's very dangerous.
And people think frostbite is like, I'm out in the snow, but it doesn't have to be that way.
Okay, mostly the fingers and the toes.
Yeah.
Why does that happen? Because the body's very smart. It protects the most important organs, the heart and the brain. So it shuts down the circulation to the fingers and the toes. So they get cold first because they have no blood supply. How do you prevent it? You prevent it by really good gloves, not the ones you buy on the street. Really warm gloves,
okay,
and good boots, socks, and if it does happen, you come in warm slowly.
Okay.
That's the key.
And this is something that we don't think about. Depression when it comes to the weather, because it is downright depressing.
So 4% of Americans will suffer from seasonal affective disorder. So we know now in the cold weather where nobody goes outside and people live alone. So check on your relatives, your elderly friends and relatives and neighbors. Make sure that they're doing
Everybody's doing okay.
Right.
Yeah, it is the season for that to happen. Let's also talk about heart attacks. I think about heart attacks, I always think about shoveling snow. But it's not about shoveling snow. We're talking about this cold weather. It just kind of constricts everything in your body, doesn't it?
It's called vasospasm. So you breathe in that cold air without filtering. The key is filtering through a scarf. That's the most important. So you filter it, the nose and the mouth, through a scarf. It will protect that vasospasm from occurring in the lungs and in the heart, because we do see a 70% increase in heart attacks in the really cold weather. 70% increase. So please, if you are at risk for heart disease, please stay home today.
Well, Dr. Nancy Simpkins, great advice. You are good TV, my friend.
Thank you so much.
Very clear and concise.
Good to see you.
Good to see you, too. And thank you for keeping us safe and warm in this weather.